Hello everyone, and welcome to another episode of Ask Dr. Bob. We have some very, very interesting questions today, and I do appreciate each and every one of them. Question number one came from Selena Naturally, the Celtic sea salt people, someone in their organization or one of their customers. Can oil pulling help? Well, oil pulling, for those of you who may or may not know what that is, you could use either coconut oil or olive oil, and you put it in your mouth and you swish it around for a minimum of 5 minutes. And I did some of my own personal research on this because I've had individuals come into the practice say they've been doing oil pulling, and it made me kind of wonder what exactly that was. Well, because of the nature of the oil and the amount of bacteria that is located in your mouth, the whole purpose and concept of oil pulling is literally purifying the ecosystem in your body. You do not, I will repeat, you do not want to swallow any of that oil because that oil is pulling toxins from your mouth area. Somebody asked a question from one of my other videos, says, Dr. Bob, could you explain how the thyroid could cause wide-spaced teeth? Well, to give you the exact physiology, I cannot do that. But I have followed Dr. Broda, who was a healthcare provider, who did, they said, when I looked up the research on this, 70,000 autopsies in reference to thyroid function. And he noticed that individuals, it might not be everybody, who tended to have subpar or low thyroid function would have wide-spaced teeth. And it's usually, from what I have seen, that center spacing. So if you have the center spacing, it does not mean you have low thyroid. And if you don't have the spacing in there, don't think that you might not have a thyroid issue. So I'm just trying to qualify all of that. Dr. Bob, I had Hashimotos, which by the way is an autoimmune problem, and I had my thyroid totally removed. Any suggestions? Well, when I listen to my mentors and I talk and I evaluate individuals, you probably need to be on some kind of thyroid medication, because you do need T4 and your body is not using that or making that anymore. Dr. Bob, how often do I need to have my adrenals tested? Well, you know, it depends on your lifestyle. If you have a very extensive lifestyle and you are burning the candle at both ends and you hold 14 plates up in the air and you're really stressed and bright light bothers your eyes, you get dizzy from a sit to a stand position, if you love to eat salty food, you may want to have your blood pressure tested every 2 or 3 weeks, and it normally should rise from a sit to a stand position. But if your blood pressure drops, that alone is just a very simple, non-invasive test. You can do adrenal stress index every 3 to 6 months depending on what exactly you're trying to do. So the blood pressure test is very simple, and you can do that on a regular basis. And we do see that blood pressure improve as little as sometimes 3 or 4 weeks. It just depends on the stress and what you're taking. We use our remedies, our neonatal glandular bovine products. We also use pantothenic acid, and encourage our practice members to stay away from sugar because that really will deplete the adrenal gland. What can you do to naturally help essential tremor get better? You know, I really don't know if I can give you a logical answer for that. If I was to do anything, I would take minerals. That would be my best answer for you. I would look to see if you're taking what kind of medication, because I've had people have medication bad effects cause tremors, and you may consider being checked for parasites or unfriendly organisms in your body. Dr. Bob, I've been taking a liver product for my estrogen liver. I noticed it causes me to have lower back pain, so I stopped taking it and the pain went away. What do you think could cause the pain, and should I continue taking it? Well, it's very possible that the liver herbs are causing a compromise on your liver, and we have seen in our experience that individuals who have a large liver will rock their pelvis. So you may consider trying a different herb, maybe some dandelion root, eat Dr. Bob's ABCs, that half a red apple, 1/3 cup of beet fiber, and immediate medium carrot are really important. Dr. Bob, how are the liver and detoxifying in your body related? Your liver is your main oil filter in your body. And when your liver is functioning, it can do all of its detoxifying principles. So, you know, stay away from sugar. I would be aware of the medications you're putting in. Are they causing a side or bad effect? Whatever you're putting in and on your body needs to be pure. My name is Dr. Bob DeMaria, the Drugless Doctor.